You're listening to Sexual Health and Gynecology on Sirius XM Doctor Radio.
Welcome back, everyone. This is Sexual Health and Gynecology, and I'm Dr. Miriam Greene. Here to speak with me is Dr. Wendy Berg. She is a professor of radiology at the University of Pittsburgh School of Medicine, and she specializes in breast imaging. She co-developed and launched the website Densebreast-info.org, for which she continues to be the chief scientific advisor. And I think that that's a great site for women to go to who have dense breasts and have a lot of questions. Is that correct?
Yeah,
Yes.
Densebreast-info.org is really meant to provide the information a patient and her doctor would need to review to consider having extra testing like an MRI or contrast mammogram or ultrasound, depending on what's available for her. And it also has information about insurance laws in your state, so you can find out even more what you might qualify for. And they're actually, interestingly, insurance is always a big issue to talk about when we talk about supplemental screening. Right now, there are 35 states plus the District of Columbia where there are laws that require insurance to cover supplemental screening with ultrasound or MRI in dense breasts. 3 states right now actually already include contrast mammography under insurance required coverage. And that would be Alaska, Mississippi, and Arkansas. The issue right now, as I said, is that it's not approved for screening, so it's not something that you can just go and get. But they are anticipating the success from it. And again, it's easy to implement and easy to have it done. In insurance, I should point out, even if the state has an insurance law, and I mentioned 35 states plus DC do, that require coverage for supplemental screening, even with those laws, most insurance companies are exempt from those state laws. Any federal plans, the VA, any national plans, Medicare, Medicaid, they're all exempt from state laws. And so we really do need a national standard. And there is something called the Find It Early Act that has been introduced a few times, is going to be reintroduced, that would require all national standard for insurance to cover not only the supplemental screening, but also diagnostic testing up to and including a biopsy if needed.
I want to know exactly what does it mean for the listener to have dense breasts? Because a lot of my patients go like, oh, I have dense breasts. And I think that they feel their breasts and they'll go like, see, my breasts are very dense. But that's not true. It's not true at all.
It's not how a breast feels or looks clinically. If you just look at your breasts in the mirror, it really comes down to how much glandular tissue there is, which is where the milk can be produced, and also the fibrous supporting tissue, and together we consider that fibroglandular tissue, versus fat. And that's something that we see on a mammogram. And when we do a mammogram, there are 4 categories we use to describe the breast density, ranging from fatty to scattered to heterogeneously dense to extremely dense. And those last 2 categories are considered dense. And it's important because the denser tissue looks white on a mammogram, and so does cancer. And so the biggest issue is that we can miss a cancer hidden by that dense tissue.
And the patient should be aware of how dense their breasts really are. I would say most people fall into the B and the C category.
Correct,
which is scattered and heterogeneously dense.
I think the most populated category is the scattered, which is not dense. One good thing is that since September of 2024, the Food and Drug Administration has required that we actually tell the patient in the letter that has her mammogram results whether she has dense breasts or if her breasts are not dense. And unfortunately, the additional category of whether it's heterogeneously dense or extremely dense does matter. And that would be something that's always in the report from the mammogram that goes to her doctor. And so if she has, My Health or some other electronic way to review her medical records.
My chart.
Exactly, my chart. She can look in her record and see that information from the mammogram report. And if it says she has extremely dense breasts, that's the highest category. And we know we miss at least 40% of cancers, almost half, in that type of breast tissue on the mammogram alone. So it's really time to start considering getting additional screening. If an MRI can be done, that's the most sensitive test that's most widely available. We're going to talk more about contrast mammograms, which I think are very exciting. Ultrasound finds a few cancers, but it's much less effective than the contrast method.
Totally.